also call 707-542-8346 for a complimentary consultation. Dr. Tom has been voted by you Best Cosmetic Surgeon for 8 years and Best Aesthetician for 3 years, which is really a great endorsement for his amazing team. Our guest today is Paris. Paris is the patient coordinator and skincare specialist with Dr. Tom Cosmetic Surgery. Paris, thanks for being here.
Thank you. It's a pleasure to be here with all you all.
We love having Paris here. Happy New Year, Michelle.
Happy New Year.
Happy New Year. Happy 2024. And I'm really excited to have Paris here. Paris, what position do you have at our office?
I am a patient coordinator and I also help with skincare.
So do you know why I hired you?
Maybe some skincare qualifications? I don't know.
Actually, I hired you because your husband's from Michigan.
Oh, I love
so
it.
we better say hi. Say hi, Steve. Hi, Steve. So your husband's from Michigan, and so, I'm a big Michigan Wolverine fan. That's my alma mater, and we won the Rose Bowl, so we're on to the national championship.
Absolutely.
Hopefully I can brag in another week or so. We'll see.
I love that.
So Paris, thank you for being here. I'm really excited. Michelle, thank you for introducing Paris. Paris has been with us now for 2 years, and we love having her. We were very fortunate to have her join us. Paris is our patient coordinator and also is, as she had mentioned, a skincare specialist.
Yes.
And so she is probably our key person to go to when we're talking about skincare products and so forth. And so when we talk about skincare products, can you tell me, why do you think skincare products are important?
Skincare is important, and the reason is I feel so passionate about skincare with our patients, clients in the past, is it is our investment that we present when we come into your office. If we maintain with good skincare, we're protecting our investment that we are coming in to see you for, and in general, just a great appearance, giving our skin a great appearance.
I think that's really important. So, people come to see us when we know that when we try to break through, it's about this wrinkle or this or whatever, the little thing that they might be concerned about. It's really about improving their self-confidence.
Absolutely.
And one of the first things that people look at, besides our eyes, is our skin. Okay, and that's why acne is such a psychological tough thing for us when we're teenagers and even as adults. It can be devastating for us emotionally, and that's how important skincare is. So Paris, what I'd like to know is, when I opened up, it was originally the Aesthetic Laser and Vein Center. Now we're known as Dr. Tom Cosmetic Surgery. But back in the year 2000, when the original staff had talked to me about bringing skincare products to our office, I kind of laughed a little bit because I was a previous general vascular transplant surgeon. Like, oh, come on, skincare products. I mean, just send them to the department store. And boy, was I wrong. Yes. Okay, I was completely wrong. Why is it important that we carry our skincare products at Dr. Tom Cosmetic Surgery?
Well, one, it definitely complements the treatments we do in our office. And like we just said, the appearance, we're investing in all these wonderful treatments in your office and our office. And we want to maintain it at home also and give them that beautiful appearance. But when you purchase over the counter, sometimes you aren't able to get the higher concentrations of these active ingredients as we can offer to our patients in the medical office with you as our doctor overseeing. And we also connect some of our very nice new product lines that we carry in your office, and they have just higher concentrations, and they complement the treatments that we're offering to our patients in the back treatment rooms.
Okay, so as we're making these recommendations to patients, Paris, I was very impressed by how expensive products are at department stores.
Yes.
And because I thought, okay, these are the prices that ours are, and everything's costing $1 million trillion nowadays.
Yes.
And we know that, and so we definitely want to make sure that whatever we're carrying is delivering a good bang for your dollar.
Absolutely.
Okay. And I was very impressed with the fact that department stores were so expensive, and yet we have, as you mentioned, the higher concentration of active ingredients.
Very comparable.
Okay.
Prices are very comparable.
And so that it does translate into that. And I know that, I don't want to mention the name, but you work for probably one of the largest,
Yes.
and that was actually attractive to me because then I knew that skincare was, you were passionate about it, and you were also good at educating people. But you work for one of the largest skincare chains. I
Yes,
mean,
that's a nice way to put it.
if you were to say the name, everybody would know it.
Yeah.
They're either they've gone there, their daughter's gone there, their mother's gone there, somebody's gone there. Okay. So do you find the difference or the advantage of working with us in terms of what we can offer versus working in that large skincare chain store?
Well, I feel the benefits are, again, the products that we offer are, again, that they have higher concentrations of the active ingredients, and they're all backed by science. We don't have to choose, comparable products that may not have as much efficacy. So yes,
okay.
I really feel that the
So
lines
you find
we
that they're
carry-
more effective. All right,
Definitely.
and so what are some of the ingredients that you
yes.
find are important in skincare products? Sort of, we're on the radio, and again, thank you everybody for listening to us. We are recording this live as well to be placed on YouTube, so go to Dr. Walter Tom on YouTube, and you'll get to see Paris. Okay, wave Paris for everybody here, okay, and you'll get to see Paris, who is our wonderful patient coordinator and skincare specialist. But what are some of maybe the key, driving along, what are some of the key ingredients that you like in our products, whether it's our Dr. Tom Dr. Tom line or one of our other lines like Abaji, Skin Better? What are you
key ingredients
that
Absolutely.
you like? Yes, please.
Key ingredients, one are L-ascorbic acid, vitamin C based. So if you're looking for a vitamin C, I get a lot of patients come in, I have one at home. Is it L-ascorbic acid? I believe that is the best vitamin C that you can, invest in.
So you like vitamin C, okay,
Absolutely.
ascorbic acid.
Yes.
You like
It's
it
nice and stable.
because it's an antioxidant, okay? And so people hear about that, and it's funny. So you can tell that Paris is, is definitely a skincare specialist. So she goes right up to the higher echelon. So I'm going to bring you back down here, and I'm going to go down with a little bit more of some of the more basic active ingredients. And I'm throwing Paris now because she was a little nervous coming on first time on the radio with us, but you're doing great, Paris. And so can you tell me, what other active ingredients do you think are important in basic skincare lines?
Basic skincare, hyaluronic acid.
Okay, and so hyaluronic acid or hyaluronic gel, what is the function of hyaluronic acid?
What it's going to do, it's going to bind moisture to your skin in a nice weightless form. So you can boost it in your moisturizer. It comes like a serum, and you can boost it in your moisturizer to give you extra hydration throughout the day. Or for myself, I'm more combination, and so I need just a nice lightweight form of hydration, and that will give that to me underneath my sunscreen each day and in the evening. So it's wonderful at gentlemen also. It's a great way too. So hyaluronic acid is one.
Was one, and what's the other one?
I would say ceramides in your moisturizers are very important. Those also will keep the lipid barrier of our skin, our surface of our skin, nice and moist, so that our skin doesn't break down throughout the day. Keeping our skin hydrated is really important. And then I'm thinking maybe you're thinking of Retin-A or retinols in the evenings.
You've been working with me for a while.
Active
I was going to say,
ingredients,
you jumped up to ceramides, okay, and now you're going back down to Retin-A.
Yeah.
Absolutely.
So those are three.
Okay, so Retin-A is really important.
Yes.
When you look at the various product lines and everything, Retin-A is absolutely the key component that's been shown medically to help as an anti-aging. And I know that word is used a lot, but it helps with wrinkles and cellular turnover of the skin. So Retin-A is a wonderful skincare product that we carry, okay? But sometimes it can be a little bit aggressive.
Yes.
People who have fairer skin, they may not be able to tolerate it, where maybe their skin feels a little irritated or a little bit more peeling that they want. Do they have alternatives to Retin-A?
Absolutely. So Dr. Tom has our wonderful, beautiful skincare line. In that line, we have two forms of retinol, so it's a little gentler, and we can introduce our patients who can't hold up to the Retin-A. It's just a little too strong for their skin, or they might feel too irritated and not be able to wear it consistently or use it consistently every evening. With the retinol, you can maybe, find that consistency in your nighttime routine.
That's fantastic, and already I can see that we need to bring it back because we're not even going to get to all the case studies that I want to do. Okay,
I'm sorry.
so no, that's perfect. You're doing great. We're here to educate our friends out there in Radio Land and KSRO Radio Land. So Paris, what I would like to do actually, and try to make it interesting for our audience, is to present some real live case studies and real live people. Okay, and so the real live people are going to be our staff members. Okay, and so why don't we start off with Mary? Mary is our lead nurse. She's either I'm going to say on the older end of the Gen Xers, or she's a baby boomer, okay, kind of age group, and she looks about 10 years younger. What would you recommend for Mary?
So Mary and I've spoken about her skin. She, again, being a Gen Xer, we need to really focus on rejuvenating our skin and keeping our collagen production going. So she uses a little bit of vitamin C, which is great for, again, Gen Xers, but we can definitely get the younger generations in on that.
So you're recommending vitamin C, and so let me just backtrack a little bit. That Mary is half Mexican and half Portuguese, and so you would tend to think that you would have thicker, oilier skin, which is really more beneficial in terms of the aging process, and indeed she has very thin skin, and it tends to be drier, okay? Interesting, it tends to be drier because that's your last name, Mary Dryer, so her skin's a little bit drier. So you went to vitamin C, and so what are the benefits of vitamin C for Mary?
For Mary, it's collagen boosting. Wonderful. Vitamin C is wonderful. It brightens, it lightens, and it tightens our skin, helps production of the collagen. Every day, once a day in the morning is all you need to do. And then from there, I've talked to her about moisturizers, and her skin can kind of be a little congested from too heavy of a cream. So that
she breaks out.
She does. I do too.
She's
half
half Mexican and half Portuguese, and she's more like a white girl, right? I mean, that's just, we joke about that, but she's more like a Northern European girl.
Absolutely.
All right. So, what do you recommend?
So I recommended Dr. Tom's Quench. It's a hyaluronic acid serum. It's lightweight, so it won't clog her pores, but it'll give her that hydration all day. And then our Perfect Skin sunscreen by Dr. Tom is a great way to lock it in, and for her, that's enough moisture.
Okay. All right. So that sounds great, and I like, we'll just kind of keep it simple there. Let's move on to our second case. So our second case, and it's interesting because I just had Mary on one of our broadcasts here, and so she's on YouTube, and I had her come in with our medical assistant Bridie, who is our case number 2. And Bridie, and you can hear the name, is about as Irish as they come, right?
Yes.
And she's a young Gen Xer, okay?
Absolutely.
What would you recommend for Bridie?
Well, Bridie, again, having the Irish fair skin, may tend to be a little more red, have a little more redness, a little reddiness to her skin, and so she has to be very careful. However, I know she's had hyperpigmentation, so she's used our Obagi system to really lift up any discoloration she acclimated to, or she had built up throughout her earlier years. So when she came to our office, she's used the Obagi system.
So what is in the Obagi? Go ahead. I interrupted you.
No, you're good. So the Obagi system is great for hyperpigmentation, the sun damage, and a lot of our patients have that, and it helps with some of our. We partner it with some of our laser treatments and some other additional treatments in our office to give them that extra benefit. But getting back to her Irish skin, it's a little more on the red side. So we use it's a redness serum by Dr. Tom's called Phyto, and it takes out the redness in the skin with a botanical blend, and you can use it twice a day. It's really also nice for if you are using retinols at night, you can add that over it to help with any irritation from your retinols or retin-A if you can tolerate
that's really great. And so Phyto, it's Phyto, and it's part of our Dr. Tom line, and we work with the compounding pharmacy to really try to get the products that we think are going to deliver for our patients. And I love it for especially sensitive skin patients. I tend to say Northern European because we're thinking Irish and all, but it can be like with Mary, who is Portuguese and Mexican. And I'm mentioning all these ethnicities because it helps to understand skin, because we're all so different, and we are a product of our DNA. The Phyto is a great soothing. It's very, very soothing, and can calm redness, and that's what I like about the Phyto.
Yes.
I think that's great.
And we do apply it on our laser patients too. After they put a little bit on to calm their redness right before they go.
Right. If you have rosacea, I think that this is even a better product. So that's what you're going to recommend for Bridie.
Yes.
And so tell me, as we're moving on, so we're going to kind of go up and down the age spectrum here. What about you? How would you describe your skin?
Boy, I'm a lot of fun. I have
You're a lot of fun.
My skin is all over the place, but I have been very lucky as I've gotten older, and that is because I started using vitamin C. And so I'm very passionate about vitamin C. I've had skin cancer, so I'm very passionate about SPF. I'm wearing that every day, even if it's foggy out. Very passionate about that. And I have that oily combination older gal skin. So for me, I need to exfoliate a little bit. I think everybody needs to exfoliate. We can talk about that in another show.
She's already invited us. She was nervous, and now she's invited herself back. I like it. I love it, Paris. Okay, go ahead.
But I find that I need to exfoliate because I do have the more textured. That's my main concern, is I have a lot of texture. So I do. We have a brand called Skin Better, and they have these wonderful. They have a wonderful also a retinol that's great that you can be consistent with for sensitive skin, but they also have these exfoliating peel pads, and I love them. So you can use them every night. I use them about 3 nights a week.
So let's go back. I'm going to interrupt you for a second. Let's go back, because I can tell you're getting passionate and you're picking up the speed on getting this information out to our listeners, and I appreciate that. Yes. Exfoliant skin pads?
They're peel pads. Yeah.
Okay, tell us a little bit more about that. What's in them? Why is it so great? Why do you love it? Because texture is your issue, correct?
That's my issue. That's my main issue, and so that's what I really feel they benefit my skin, and they benefit a lot of our patients that come in as we get older. Our pores get a little larger, the fine lines, our products aren't absorbing in. So I'd say, how about some peel pads by our Skin Better brand, and they have a little bit of salicylic, a little lactic, glycolic. It's a beautiful blend. They do tingle a little bit, so you have to kind of get used to that. But they're wonderful, and you get a really great result, and my skin looks smoother. It also allows my skin to look more polished so that my products will absorb in nicely. Right. So I feel that they really do help with my texture. Right.
And Paris is very photogenic, so if you're on YouTube, you're going to see Paris and how great she looks, and a big part of it is your skincare. And Paris, we've talked about that. It's not necessarily about the wrinkle or the little bit of the jowl or whatever. We all don't want those things, of course, but it's really about skin quality, and it goes back to the very first question I asked you about the importance of skincare.
Absolutely.
And so the exfoliant, so I like that, the exfoliant skin pads, you had mentioned Skin Better, and so what I want to get out to our audience, to our listeners, is the fact that we're not just wed to one type, okay? If the world is a nail, then the hammer's the only tool, right? Or if your hammer's the only tool, then everything's a nail, right? So you need to really look at different issues that patients have. And so what we do is we kind of figure out what the majority of people have, and it doesn't matter whether it's the Dr. Tom line, whether it's Skin Better, or it's Abaji, we can kind of mix, and that's where somebody like you, Paris, or Faith, our other patient coordinator, who can help to guide our patients, and we appreciate that. Thank you.
Absolutely.
So looking at that, I want to go back for just a moment to Abaji, because you mentioned Abaji, and it's funny that you would mention it for Bridie, who is our Irish as Irish can be, and it's not who we typically think of for Abaji. We tend to think of Abaji a lot of times more for what I call, and I consider myself a brown baby, right? Brown babies who tend to have a little bit more of that pigmentation from the sun. And it is a wonderful skincare line. I have been on Abaji on and off for 20 years, and when people think that maybe I look younger than my age, I hope I still do.
You do, absolutely.
That a lot of it is skin quality, and I attribute a lot of that to our Abaji skincare line, and that's based on hydroquinone, which is a bleaching agent, and retin-A. And again, the advantage of retin-A is exfoliating, but retin-A also helps for us to drive the active ingredients because of the exfoliation into your skin to be effective.
Absolutely.
Okay. So that's great. So thank you for sharing. Is there any other tips that you would say for yourself? You're a Gen Xer?
Yeah, I guess.
You're a Gen Xer. Okay, all right. So just, okay. You said
I'm just going to say it.
Okay. So 57 years young. I love it. And so what about we have some babies in the office, right? I mean, they're 20. We had a 23-year-old, a 27-year-old, a 30-year-old. Okay,
I love having
all the age ranges. What would you kind of recommend for, let's say, entry-level patients or entry-level people who are young, where they want to protect their skin, they appreciate having good skin or want better skin? What would you usually recommend, just generically, for these younger kids?
Absolutely, I would make sure they have an antioxidant serum. It could be vitamin C would be great, that's going to be my big favorite one, but we do have additional antioxidant serums in our office. Sunscreen is huge. Wash your face at night. good, good foaming, gentle exfoliating, whatever you need, but just wash your makeup off at night. And gentlemen, please wash your skin off at night. I feel like a good cleanser. Sunscreen is key because a lot of us are finding as we get older, the hyperpigmentation is really coming out. And even in your 30s, you'll start seeing it. And that's why Bridie, all of a sudden she realized, I think I actually need to address, I'm very fair. I must have gotten some sun and I need to so she found
and she's very good about protecting it, but that's just part of life.
It's
and, we're out living
yes.
and with the sun damage and being on the Abaji and the Retin-A is very helpful. What about Retin-A on these youngsters, on the Gen Zers and the millennials? Should they be on Retin-A or something different?
I will find that many of the younger 20-somethings, they probably are already on a Retin-A if they'd had acne. So funny enough, I've been on Retin-A since I was 12 because I've always had acne issues.
And that's why, even though you're hard on yourself, you think your texture is an issue, that's why your skin looks so good, because you've been on Retin-A for decades, right?
Yes, off and on for decades.
Okay.
But yes, they can definitely use, we have a nice small percentage of Retin-A that would be great. They could use a couple nights a week, or even every evening with a little bit of moisturizer. I don't see why not, unless they're having a reaction. Then maybe give them something gentle, but we always need to keep exfoliating our skin.
So Retin-A is the granddaddy, if you will, and then if you are sensitive, then we would move to a retinol. Okay, and so so people hear that, Retin-A or retinol. Okay, so you had mentioned you made a shout out to men, and so we have a lot of male listeners here as well. Okay,
men,
and so we're going to just speak generically. Okay, we tend to just be. I'm not going to say we're less high maintenance. What we are is we're actually kind of negligent. Okay, that's the way I would probably categorize ourselves.
That's a nice
is that we're negligent in terms of taking care of our skin.
Yes.
And we're in a rush. And we're also busy. Blah blah blah. What would you kind of generically recommend for men?
Well, first of all, they need multitaskers. Men are all about multitasking. They want one thing and be done. And so the first thing is always sunscreen and a good cleanser. So
Absolutely.
If you could just get them to cleanse their skin and put some sunscreen on, great. But if I can get one more product on their skin, it would be like an antioxidant serum we carry for men, actually, specifically. Women can use it too, but we gear it towards our gentlemen, is Solo. And it is an antioxidant multitasking serum that they can pop on. It gives moisture. It protects their skin with antioxidants throughout the day. And I would recommend that serum. It's like a lightweight moisturizer.
So you're going to wash their face, and we have gentle cleansers, okay? And sunblock, absolutely. Sunblock. You want to save money. You don't want to come and see us. You don't want to contribute to my grandson Wyatt's college education. Then don't wear sunscreen. But wear sunscreen, and you're going to save a lot of money. So wear sunscreen, okay? And then you had mentioned an antioxidant serum for men.
Yes.
As well.
Absolutely.
Okay. And so it's interesting that you went to sort of the multitasker all-in-one, and I need to listen to you because you're at the front lines talking to our public or to our patients and to our male patients. We're seeing more and more men in our office, aren't we? Which is wonderful. I love it when another Y chromosome walks into the office. Okay. But it wouldn't have been the answer that I would have given. It's interesting in that I feel like for men is that we tend to want to keep things simplified, and that might go along with the multitasker and multiple, a product that can do multiple things. But I was thinking more along the lines of simplicity in terms of still a cleanser and still a sunblock. But where I would go then in addition would be a hydrator. Okay, so I'm going to talk now more about baby boomer men, Gen Xer men. Okay, maybe millennials may or may not need it as much. Gen Zers, again, maybe or maybe not as much, depending on their intrinsic hydration status of their skin. So I would probably recommend our Dr. Tom Quench, which I love, which is the hyaluronic serum gel. I love that. I take that. In fact, that's from a business standpoint. I was just in there, and I'm going to Mexico tomorrow to celebrate my sister's 60th birthday, and I went to go grab some Dr. Tom Quench off the shelf, and we only had 3 left, and I said, well, I mean, I'm the owner, so I can't take it, right? I got to save it for our patients. So I didn't get to take it, and you had me along with faith, I ended up taking the Phyto, which is a calming,
Yes.
and also can hydrate as well. And so I'm taking my Phyto along with me, but kind of wishing that I could adopt my Quench, but we'll have to order more of that for hydration. And then the last thing that I would mention would be, again, me being more medical, would be the Retin-A's, okay?
Yes.
And that's something, so for me, a lot of times for guys, if they're, really, I'm going to call them negligent, low maintenance, and they want to just do something and get out of there. I appreciate your kind of all-in-one that you were talking about, but I might recommend, besides washing their face and the sunblock, is using a Retin-A at night, okay, and then using the Dr. Tom Quench in the morning. So
I like the Quench too, and we've spoken about that, and we do, I think almost, 85% of our patients probably use the Quench in one form or another.
That's why I can't take it
It's
to Mexico
pretty
with me.
amazing.
Okay,
Yeah, I'm sorry about that.
okay,
We'll get that on the shelves.
Okay, but so there's, you can tell, so just for our listeners, you can see that here we are, in the same office, and we're listing all these different things and how it's just different, and we may have different recommendations. So it's a journey, and we tell people we're happy to hold your hand and walk there, or hold your hand and run there. So what we want to do is we want to customize it to you. Evaluation, we're there, we're readily available for you. So we'd appreciate you coming in anytime to talk to us. We have the greatest patient coordinators, right? We have, and their names, Paris and Faith. Is that the best?
She's the best.
And so I want to wish everybody out there a happy new year. We're into the last minute of our show here. Paris, thank you for coming and joining us.
Thank you for having me.
You
This
did
was a lot of
great,
fun.
and we're going to get you back here. And I want to thank you, Michelle, for producing it. And we will be back and be talking about SmartLipo with Robin Berardini in one of our future shows. So thank you, everybody, and happy New Year.
Tom.
All right, so be sure to check out Dr. Walter Tom online at drtomcosmetic.com. You can also call for a free consultation, talk about skin.